This is a 50-year-old woman who has the early signs of typical aging, which is number one, around the eyes, and then the second, the sagginess on the lower part of the face. So around the eyes, the typical signs of aging is the upper eyelid hooding, which means the upper eyelid skin is migrating down, along with the bags under the eyes. So a lot of times whenever we see the sagginess of the upper eyelid, it's usually a combination of extra skin in the upper eyelid, but a lot of times more important than that is actually the eyebrow descending down. And the reason why the eyebrow descends down is because the forehead drops as we get older. So with her, what we decided to do after discussion was we did what's known as an endoscopic brow lift, which means using minimal incision technique, we elevated the entire forehead. And what that does is that it makes her eyes look fresher without really touching her eyes. Okay? And a lot of times that's actually sometimes more natural. In addition, she has the bags under the eyes. So what we did was we took some of the fat that was herniating out, and then we moved that down to the tear trough region, which is the hollow region just underneath the bag. We also took out some extra skin, and we tightened the end of the lower eyelid margin. In addition, because of the sagginess of the lower part of the face, we did a minimally invasive mini facelift, and our version that we coined the term Wavelift. And what that means is through a small incision, and that incision is sort of confined to the upper part of the face, we make that incision and then we insert an endoscope or a camera to help us dissect under the muscle and do the lifting. It is a minimally invasive, which means small incision with faster recovery time. And what it does is that it really does truly help rejuvenate the lower part of the face. And because we're actually manipulating the muscle, the result actually looks more natural and more longer lasting.